Good morning, everyone. How are you all? It is so good to be here. I have to say this is 12 years now, and I was one of the people who actually was able to begin this 12 years ago. So it's just a joy to me that we continue to keep doing this over and over again. And the need is real. So it's important that we be here. So Mr. Mitra sent me this bio, so I'm going to read what she said. But I need my reading glasses, so. There's also a beautiful picture of her, but you can actually see her in person here. So. She's worked in the HIV/AIDS field for over 20 years. She's had more than 30 years of lived experience. I started my career as a peer assistant with the Women Rising Project under the umbrella of AIDS Services of Austin, a program for women living with HIV. She later became a prevention program specialist, providing testing and counseling for at-risk populations, and then later transitioned into a counseling-only role for the CLEAR program and evidence-based HIV prevention and health promotion intervention for positives. I left AIDS Services of Austin in 2018 to work with Austin Public Health. She's certified with Texas Department of State Health Services as both a community health worker and a community health worker instructor. She's facilitated support groups, done public speaking at a conference in small groups. She's co-facilitated discussion topics on HIV, STI, sexuality classes as a guest speaker at Southwestern University in Georgetown for several years. The motto that Women Rising Project ingrained in me is, I can be changed by what happens to me, but I refuse to be reduced by it. A quote from Maya Angelou. So I present to you Ms. Demetra Tennison.
So hello, everyone, and I do apologize for being late. I never read the program, but anyway, thank you for having me, and I'm grateful for this opportunity. I'm grateful for this opportunity. Can you hear me now? Yes. I can speak louder. That's working. They said they can hear me. I'm not sure that it's got. Okay. Okay, so I'm grateful to be here. And most of all, I'm grateful that I'm living, because living with HIV back in the day was not a promised long life expansion. And one thing I'm grateful for, I have my older daughter in the room. Raise your hand, Tangi. She's my oldest. And I'm so grateful for my family. They have always been my support network. So I know I kind of ran in on my time, so I'm gonna expedite this. And I have a quick little short poem that I wrote years ago. It says, when you look at me, what do you see? Surely not HIV. I'm not bound by the stigma or the shame that HIV proclaims. I am a woman, beautifully and wonderfully made. Yes, HIV did attach itself to me, but it's such a small attachment that you don't even see it unless I speak of it. So I asked you again, when you look at me, what do you see? So I wrote that one time when I had to do an occasion for AIDS Services of Austin. And during that time, we were doing fundraising for Women Rising. So they said, do something, think of something. So that was what I thought of. I can look back then, it has truly been a journey living with HIV. It hasn't been an easy one, but I'm here today. And that just speaks of the resilience of my support network, my church, my family, and loved ones. Roger played a large portion in that also, because he always had functions and trainings that I could attend. I am who I am today because of training. One thing about being HIV positive back in the day, it was not a cute thing. Some people think it's a cute thing now, but it wasn't back then. It was so much stigma that you found yourself isolated a lot of times, and you really didn't want to talk about. It's not one of those diseases where illnesses that you have and people say, oh, no, it's like, give me 50 feet. So that was what HIV was back then. And when I was, living with it, it was a challenge, because I'm one that I want to be educated. I want to know everything about what's going on with me. I'm a self-control freak about me. Nobody else but about me. So for me to live with an illness that I didn't know about, that caused a problem for me. So what I had to do was learn about this illness. So I'm gonna back up some. First hearing about the illness, before I even knew I had it, I was like, what in the world is that they're talking about? Had no clue, didn't even know. They gave some symptoms about it, but hey, I was like, they're not even saying women can contract this virus. So hey, I'm not even worried about it. But little did I know that the virus was passed through by loving someone, being intimate with someone. So with that said, how many of you in this room are sisters to someone, brother? You can raise your hand. Mother, aunt, cousin, whatever title I left out, those are protocols and titles that we all hold. And so each one of you fit that profile of someone that could have been contracted this virus. One thing about HIV is better than human beings. Human beings discriminate, HIV do not. So we got to think about that. But here we are 30 some plus years with this illness, and people are still having problems with people living with HIV. And I've even, back in my early diagnosis, I would hear nurses talk about, well, I don't want an HIV positive patient. So that was kind of discriminating to a person that was positive, because I'm thinking, well, aren't you the educated one? Aren't you the one that knows modes of transmission? Aren't you the one that knows that universal precaution will prevent this virus or you from contracting it? So it was kind of very stigmatized, as I said earlier, a lot of stigma. It wasn't something that you celebrated. We're working with a lot of women. I had the opportunity to do trainings and facilitation. Women Rising was a great program for myself, because it taught me, it had training components attached to that. Not only that, but it had peer support. So it was what I needed at the time that I was diagnosed. So just thinking about women that I worked with, and I worked with men also, but most women would say that I didn't go to the grocery store and was shopping and looked on the shelf and said, okay, I'm gonna pick up some HIV today. No, that wasn't what people did. It wasn't something that you stood in line for. It was something that happened that you were not expecting. So like I said, back then, lots of stigma, lots of people were isolated. Some people died alone because people were afraid to touch them. There's people that had people living with HIV in their family, and they were afraid to eat at the table with them or allow them to use a plate that you could wash with bleach and soap. But no, they said no. So a lot of stigma back then, lots of stigma. And like I said, I'm really grateful for Roger Timming, because they had a care unit that would train people to go into homes and support people living with HIV and AIDS. They would do whatever they needed, housekeeping, shopping, cooking, walk the dog, whatever. So thank you, Roger, for doing that, because that made a difference to a lot of people living with this illness. So back to Women Rising. When I first thought I was positive, I'm gonna put it like that, I was married. So my husband, he was an ex-IDU user when we got married. He was clean. He did relapse. And because he relapsed, that put me at risk for contracting HIV and AIDS. And so when it came out in the news, I had no, like I said, I had no clue that I was even a person that could be, at risk for it, because they weren't saying women were one of those at risk. So, you know, he didn't even know that he was putting his family at risk. So relapse, got sick, got tested, and he was HIV positive. So at that point, my oldest, they were teens, and I was had some younger children, and so I was healthy, of course. So the virus had not, destroyed my immune system. My T cells were still in count. So therefore, I was like, well, that's you, that's not me. So you deal with it. And that's what I did. I allowed him to deal with it. I kept on working. I didn't get tested. It wasn't because I didn't have insurance, because at the time I was working for the city of Austin. So I had excellent insurance. It was just that the stigma and the fear of me knowing that I had HIV, it just kind of shut me down. It had me in a place that I couldn't even deal with it. So I didn't deal with it. So my husband dealt with it. He went to doctors. He did what he needed to do, and he got a little bit better. But eventually, he ended up with lung cancer. So he had lung cancer, and he had a combination of some different things going on with HIV and AIDS. Because you got to look at it. These cocktails didn't come out to 1995 or 1996. So this was in 89, 90, 91, 92. So even the medicine at that time was not what it is now. It just wasn't. So people were choosing either to try it or not to try it. They hadn't even got the dosing right yet. So people were very skeptical about taking HIV medication. I wasn't even thinking about it. So it wasn't even on my radar to take it. So therefore, that virus was doing damage in my body. 1990, I was still working, able to work, was doing okay. My husband, on the other hand, was not doing so well. He was struggling with the virus and taking the medicine and getting a good regimen. So eventually, like I said, he got diagnosed with lung cancer, and so he passed away in 1996. So at that time, I still was okay. I was healthy. And like I said, I had small children. So my goal was to make sure that they were well taken care of, and making sure that I did what I needed to do to keep my family intact. So taking an HIV test was not on my list to do, and I didn't do it. So 2001 rolls around, and I'm starting to get sick. I'm starting to feel like I can barely do things. And so I had a good friend, and she was gonna be here today, but she said, I told her don't worry about it. But she went with me to actually test. Now, prior to that, I had gone to the doctor because I had this horrible yeast infection. And how many of you knew that yeast infections were symptoms back then for women? If you didn't, you're hearing it now. It was, if you had some certain symptoms, that was possibility in HIV diagnosis. So, but yeast was one of them. So I had this terrible breakout of a yeast infection. Went to the doctor, and she said, you really do need to do an HIV test, because we're seeing this a lot in women coming in and presenting with these yeast infections, and they test and they have HIV. I didn't share with her that I already knew that my husband had it and he had died. I didn't. I said, well, okay, just treat me, and I'll think about it. So still I didn't. But in 2001, like I said, I started to get really, really sick. And right before I started to get sick, my friend had said, go ahead and test. You got to test. You're not going to be able to, treat if you don't test. So I went ahead and I got tested, and she went with me. And I can remember her saying, don't tell me a lot of details. She said, I'm here for you. We're friends, so don't worry about it. She said, I already know, because we talked a lot. She said, I already know. So why are you talking to me about it? Talk to the doctors, do the test. So I did the test, and yes, it came back positive, which I already knew. So I had made up my mind that I was going to go and start treatment. But before I could do that, like I said, I was already sick. This is 10 years, me living with the illness and not doing anything about it. So by that time, it had really started taking control of my immune system because it was depleting my T cells. And so I actually had worked at a center for kids that were sick. They would come into the office and get their meds, and they would come in if they were sick. And they would have to lay down till their parents pick them up. So this one day, this child comes in with this bug and just, they're sick. So of course, my immune system, which I didn't have, matter of fact, my T cells was 43 when I finally tested, and they did those tests that showed what the T cells were. They were 43. So you know that you should at least have 200 or more. So here I am at 43. So I didn't have an immune system that would fight off anything. So working with sick kids was not the thing to be doing at that time, but that's what I was doing. So after that, I got off that day, went home, and I was just sick. So I was in my room, and all of a sudden, I just felt myself going out. So I had a seizure. And my children were there. They called 911. They got me to the hospital. And of course, when I did come to, and the doctor was talking to me, and they were saying, you know, if you don't do something about this illness, you're not going to be here. You're just not going to be here. And they said, do you have children? I said, yeah, I have children. I love my children. He said, you're not going to be here to see them. You're not going to be here to take care of them. So that was the pivotal turning point in my life. I owe my children. I need to take care of me. I need to do what I need to do. Forget about the stigma. Forget about what you know I felt, my fears. And now it was hitting me right at home, and I needed to do something. So what I did was I made an appointment to go to David Powell in the hospital, because the doctor was not playing. He said, I'm not playing with you. You're not going to make it. Your T cells, you have 43 T cells. And that means, and I got diagnosed with toxoplasmosis. That's a brain something going on with HIV. So I was having seizures behind that because my immune system was so low. So there I was in the hospital having seizures, not a strong immune system. So after I got out the hospital, I kept my appointment with David Powell. I did go, because at this point it was either that or I'm gonna not be here anymore. And that wasn't what I wanted, because like I said, I have 4 beautiful children and I love them and I wanted to be here. So going to David Powell, I had a social worker, and I was talking to him, and I said, you know, I'm not gonna be able to live with this illness unless I have some support. So what is out there for women? I need to know what is available, because I know nothing about HIV and AIDS except what I hear on TV, and that's not good stuff. I said, so I need to know what it is. I need to know how to fight it. And you have to take charge. I did. I had to take charge of living with this illness. So he said, hey, I know a group, Women Rising Project. They're a support group, and I think you would do good with them. I said, okay, well, introduce me, because I need them. So at that point, I did get introduced to a beautiful lady named Sylvia Lopez, and she founded that support group for women. And so when I did meet her, she was a sweet voice on the other end saying, okay, so we do have this group, and you can go here, and I won't be in the group because I kind of am the facilitator of the group, but the ladies do the support group. It's peer led. So I was like, okay, yeah, I need to be there. So when I went, it was a great experience. The women were there and they were thriving with HIV. They were supporting each other. They were helping each other. And that was the environment that I needed. Not only with Women Rising did I get into a support group, but they had something called Rising Star University. So that university that we went to, the ladies, we would get topics brought in by the pharmaceuticals. They would talk to us about, you know, what's this and what's a T cell, how you are able to live with HIV. They didn't push their meds because that wasn't something that ASA would allow, but they did do the teaching component of it. So they taught us about, living with HIV and not dying with HIV. So with that, Rising Star University, I learned so much. I gained so much knowledge. I gained so much understanding about what I was living with. And sure, I had some days where I was sad, I was crying, I didn't want to live, but you heard about those with me being in that fearful place, not taking meds and not getting tested. So being with Women Rising helped me to get past that. And I said, hey, you know what? I'm finna fight this thing with all the strength that I have. And eventually I started feeling better. I was taking my medicines like I should. And I was thriving. I was doing better. And so there was a position that came open with Women Rising. They needed a lead person to help facilitate, help Sylvia facilitate and do the trainings and the different classes. So I applied for it and I got the position. So that's how I got into the field of working with HIV and AIDS. I was one of the peer assistants, and we did a lot of, Sylvia did a lot of groundbreaking things. I'll just say it like that, because here today, I travel and I was at the USCA conference in Washington, and I still see women that didn't get what I got and going to a support group and the training and the knowledge that I picked up. They don't have it. So I was very blessed and privileged to be with Women Rising, because like I said, they didn't just talk at us. She taught us how to go into a doctor's office and be in partnership. Don't talk at me. We talk together. Let's discuss this. I know what T cells are. I know what a viral load is. I want a copy of my labs. I want you to sit and go over my labs with me. She empowered us that way. You're not just a victim. You are somebody that can manage this illness. And that's exactly what I did. And that's exactly what Women Rising taught us, to manage it. You be in partnership with your doctor. So I had doctors that were very shocked and very like, okay, so yeah, I need you to take time to go over these labs with me. I need to understand it. I know you read it and understand it, but I need to understand it. So let's go break these lines down and let's see it. And that's what I would do in the doctor's office. So my doctor finally grew to know who I was and appreciate it. Okay, Demetra, what's your list today? What is it you want to know today? But it was a part of me surviving and a part of me thriving and being where I am today. I'm really grateful. I see Claudella in the room also. Women Rising has an advisory board, and we had people on that advisory board made up from all different agencies. She did work with the city, but she's retired now, but she was one of them. And I used to work for her prior to HIV. So she said, Demetra, I wanted to talk to you. I wanted to encourage you. I wanted to embrace you, but it was against our, confidentiality, because I knew her. She said, I couldn't come to you. You had to come to me. And so when she saw me at the first retreat, because she, like I said, she was on the advisory board, and she was like, she hugged me and we hugged each other. And she said, I always wanted to support you, but I couldn't because you didn't open that door. So I always had people that were there, but because of my own biases toward HIV and not understanding it, I didn't even let people help me that could have helped me, because I'm sure she really could have directed me where I needed to go, but I just wasn't there. So where we are today, yeah, HIV is a chronic illness. People are managing it. It's almost like high blood pressure. You can manage it, but it's still there. It's still in the community. It's not something that you should say, well, I'm not even gonna worry about it, because I gave you a quick protocol, not a protocol, but a profile of who and what HIV likes to attach itself to. If you're an aunt, if you're a sister, if you're a brother, if you're a father, if you're a mother, because I fit all those characteristics. And I'm a human being, number one. You're a human being. So I wouldn't say never. I would just be aware, and I would, take the test. and have a conversation with your partner, who you're with, because that's another thing. Most women don't talk to or ask history, and men history of who you're gonna be intimate with. Those are conversations that you never even thought to ask. What is your past history? What did have you ever been an ID user? Have you ever did this? And not for stigmatizing reasons, but to educate yourself, to be upfront for yourself, to know what you need to know. And then you have a choice whether or not you want to be in that relationship with that person. Like I said, it's been 30 plus years for me. And I would never not tell someone up front that I'm HIV positive. You either deal with it or you don't. I don't have a problem with it because I'm not lonely and I'm not sad. Yeah, my family has been such a great support network for me. And like I said, I had great friends. My church, they were there for me. So I've never been on the end where I was so stigmatized that people rejected me. Now, I've heard horror stories, so don't get me wrong, it does exist, but that was not my story. So my heart goes out to anybody that had to go through that rejection and stigmatizing, because I always, once I did get empowered, I would tell people, I am positive. So if you have a problem with it, it's okay with me. I'm not even going to be upset with you. I want you to know, and I'll be okay. I just won't do things around you that you feel like puts you at risk. But we know that it's body fluids. We know that it's not casual contact. We know all these things. I won't say we all know all these things, but we should know all these things. We should be educated enough that we know these things so you can be a help, because I guarantee you there's somebody, a friend or a family member, that may be living with HIV, and you might not know it because they might not feel comfortable talking to you about it. So, if you're in that, if you're in their space and you're allowing them to know that you're educated about this virus, and because I can remember my nephew, I was at a family reunion. I have an older sister. It was either my younger sister or my older sister. When I told them, they decided to share it with the family. So I was like, okay. So they knew. And so I was at a family reunion. And so my nephew was saying, Amy, I have a friend that has HIV, or they died from HIV. And I understand it. I'm not worried about it. And I was like, how do you even know? But he knew. And he was trying to let me know that he was okay with it. And I was like, okay, thank you. He said, so yeah, I understand it all. I got good education about it. So that kind of put me at ease, because I didn't tell the whole family. I told my sister, my kids were first because I had to tell them, and then my sisters. And so all the other family members found out from other family members. So that's what you have to look forward to when you have family members that tell everything without letting you do it. But it's okay, because like I said, I love my family, and I would not be where I am today if I hadn't had that support. So I'm gonna quit talking, and if there's any questions, feel free. Roger.
I was, is this working? Mm-hmm. Yeah. I was watching your daughter as you were speaking, and all I saw in her face was pride and love for you. And that's where it should be. And that's what it should be all about. You mentioned what we provided years ago with these care teams. And I'm reminded because standing in the back of the room is Mr. Ken Martin, who was our executive director for several years. And it was a good companion to people who were living with this illness. So I'm grateful that you mentioned that. You mentioned your church I'm just curious if you want to share this. When you first told them, or however it is that you expressed it to them, were they immediately welcoming or hesitating or what?
Okay, so when I first told them, of course, I told them, well, my husband's been diagnosed with HIV. Well, he had AIDS because his T cells were so low. And they were like, okay, we're going to support you, just don't talk about it in the congregation. That was what they said, don't talk about it. So they were supported to the best they could. This was in 1990. So like I said, not many people knew about it, enough about it, but they were very supportive in the sense of, we support you, we support your family, just don't talk about it in the congregation. So I didn't talk about it. And like I said, I know universal precautions. I've worked in the medical field, so I knew what to do and what not to do. I know that if I got cut, take care of myself, Band-Aids. So I knew all that. So that wasn't a problem. I would not expose anybody to blood. I know that. But like I said, they just didn't want me to talk about it.
Okay.
And I didn't.
I think we have time for a couple of questions, right? So if anybody has any, I'm going to come down here so that you can talk into the microphone. Does anybody?
On the stigma side of it, I work with a lot of seniors. A lot of them are HIV positive, and they get with other seniors and they'll all sit around and talk about their diabetes, their CHF, their COPD, but none of them want to discuss their HIV because they feel like they are going to be shamed or the stigma of it affects them. What recommendations or what suggestions would you give to people about talking about their HIV with other seniors?
So if you're working with seniors, I would make sure they're educated about it. Make sure they know modes of transmission. Make sure they understand how it's transmitted, and make sure they're able to give an answer to someone that asked them a question about it. Education is key. I'm sorry. You have to know what you need to know about this, about HIV, because if you don't, somebody else could have wrong information and really stigmatize you some kind of way. So I would start with asking them would they like to get in the class. I would put them together, make that a support group, talk about it amongst yourself. What questions do you have? Because like I said, if you can get that kind of one-on-one, no discrimination in that group, they'll be more apt to want to talk about it in another open setting. And they'll be able to, have correct information. Because, today, my pet peeve when I'm in a conversation, people will say something like, what is it about HIV? Oh, it's something around having HIV and diagnosed. They just say negative things and things that are not true. And I don't mind correcting them. I don't. And it's not in an ugly way. I always say, well, excuse me, but that's not accurate information you're talking about. I said, HIV is a virus and everybody does not have AIDS. So if a person has HIV, does not mean that they automatically have AIDS. That's a diagnosis that a doctor gives, and it has to be that person T cells got below less than 200. So just kind of clarifying stuff like that. Because
I think too, a lot of times they feel shameful because a lot of times the next question is, how did you get it? And you don't get that question with other
you don't.
diseases.
You do not. And that was one of my main things, even myself living with. People always want to know how you got HIV. How did you get it, Demetra? Loving somebody. And I'm through with that question. Because if you're not in my favorite 5, but now you all know, if you're not in my favorite 5, we're not finna dialogue and dig deep because, hey, I don't even know you. It is what it is. And you have to learn how to talk to people like that, that's just wanting to know because they're nosy. Yeah, now if you really want to know because you have a loved one or we can have this conversation, but not just because you're nosy. I love someone. Next.
Any other questions? All right.
I see a hand back there.
Oh, you do? Oh,
Advice to organizations that want to start a women's support group. What advice would you give? Forming it, logistics.
I heard her. So I would say do it the peer-led. Is that what you're asking me?
Yeah,
Definitely have someone that lead it that's living with the virus, because that makes a whole difference when you're working with people and you want them to see where they can grow to. So, and educate that peer. Make sure that peer has accurate information. Don't just put them in there and they are not ready to disseminate accurate information. So peers and good information.
anyone else? Going once? Oh, who? Who was it? Did you?
Let's answer this question real quick.
Okay. I don't have a question. I just wanted to say that your poem was beautiful.
Thank you.
That's publishable, if
Oh,
you have not
wow.
already done so.
No, I have not. I need to publish it. Thank you.
A Star is Born.
I think Claudella had something.
Oh,
Okay.
no, it was for, she was pointing at her.
Got it. And I'm going to bring the mic back here to Claudella real quick.
Demetra, I just want to thank you for all that you do for our community and all the people that you've helped over the last 30 years yourself. Again, thank you, and I love you dearly.
And I also see Lee. She was on Women Rising Advisory Board too. I'm telling you that advisory board was a powerhouse because they had people from all different different agencies, and they pulled together and worked with Sylvia Lopez. So thank you also, Lee. I didn't see you at first, but thank you. Thank you. Thank you.
Demetra, I want to ask you a quick question. You had mentioned that at your church that there was some stigma there at the church. As an African American woman, as a heterosexual woman, have you run into stigmas around being HIV because people go, "Oh, I thought that was a gay disease"?
You know what? People don't expect me to be HIV positive. That's what I'll say. And so back in the day, they really didn't expect it because it was, when it was put out there, instead of it being a disease that a human being can contract, it was a disease that they said only gays contracted. So they don't, back in the day, but now they do because there's so many faces of women that are positive. So I don't see that as much today as I did back then. They were like, I thought women couldn't get it. That's what they used to say, because it was put out there as a gay disease.
Yeah, I know that we continue to see older adults who are testing positive for that very reason, because so many older adults did not grow up with HIV in their world. And so they still do not understand the basics of it. And I know even areas like out in Sun City, they see spikes of HIV, and folks that serve that area are sitting here nodding along going, yeah, for that very reason, because they just don't have that knowledge. It wasn't something that lived in their world, and so they didn't educate themselves on it. Yes, ma'am.
It's not just that they didn't live with it, it's that they can't get pregnant anymore. So they no longer use birth control.
Yeah.
So the condoms are gone, because what are you going to do with a postmenopausal woman? You don't have to prevent pregnancy. So then the barriers come down and they don't realize that they're still at risk.
Yeah. Did you want to add to that?
We work in hospice and we're nurses, and we do lots of health talks at assisted livings and communal living with elderly people, and we're getting more and more questions and having to delve into STIs more and more because people are not using birth control, and some are back in the dating scene after being widowed. You know, they had been with their spouse for 50 years, and now they're single and they're engaging in activities, but didn't have any plan for how to prevent this. And just basic education and knowledge, but also knowing that it's talking to you. You know, there's that block of people, well, that's not for me to worry about. Teenagers need to worry about STIs. Well, some of these assisted livings are hopping. Yeah.
If you don't think older adults are having sex, you are wrong.
Yes, thank you.
Yeah. All right. Got time for maybe one more question. I see you in the back and I'm coming to you.
If we wanted to refer somebody to Women Rising or a similar peer-led support group, where would we go find that? I guess on the internet or?
Well, I don't think so much on the internet because ASA does not exist anymore, but Vivint Care does. So now they have it under their different organizations. But just go there to Vivint Care and ask for their support group, their women's support group. It's not on the level that it once was because, like I said, that educational component. I'm still a member there. I still sit on the advisory board, but that educational component, it's not there right now. Right now, I'm going to say. So we're hoping to bring it back so we can catch some, because we have some young women that are diagnosed now. They're still in childbearing age. So we have some young women. So we're hoping to do the educational component, but it's under Vivint Care. Claudella knows about it. Lee knows about it. So those are people that you can reach out to. It still exists, but not on that high level that it once was.
All right. Demetra, thank you so very much for spending your morning with us to share your story and your information. We appreciate it. We always want to start our conference with that great point that we're living with HIV. Our disease does not define us. We are people who just happen to be older, who just happen to be African American, who just happen to be HIV positive. And we're not defined by those things.